Hello, everyone. My name is Dr. Mohammed Ali Gofran. I'll be the moderator for today's session. So, a little introduction about myself. I'm currently working as a specialty registrar in University Hospitals, Birmingham NHS Foundation Trust. I have a background of FCPS in general surgery. Today, I'm moderating this session for Dr. Amara Salam. So she is currently working as a senior clinical fellow in Manchester University NHS Foundation Trust. She has been working in NHS for past 3 years. She has completed her FCPS in general surgery from Pakistan. So today's session is all about research, how to initiate a research project, and what are the hurdles that you may encounter during its publication. So I would like to hand over to Dr. Amara Salam, who's going to take over from now.
Hi, greetings everyone. Assalamu alaikum. Good morning, good evening, whatever your time zone is. So this is going to be a very basic session on research. It's basically for the beginners. And the registrations which I have received were like 50% of the people had never conducted a research. So it's going to be a very basic session. And if you have any questions, just put them in the chat box and we'll try to accommodate them in last, 10-15 minutes at the end of session. So I'll start sharing my screen. Is it visible, Ali? Okay. So whenever we think about research, especially when we are a beginner, this is our situation we all have been through. It looks quite a tedious job. It looks very difficult, and we all think that we can't do it. I still remember we in our graduate medical school in our fourth year we had to do a research, and we have to present that research to our whole batch. And I still remember when we did that research and when we presented that research to the batch, and we were told that there is a potential to publication for this research. And I literally remember saying to myself that this is a crap piece of work. This can never be published. Surprisingly, that got published in a PubMed index journal. So that's what I want to tell you is first thing is you have to believe in yourself that this can be done and you can do it. So before starting research, you have to have that belief that you can do it. This is just we did a poll on our page, and 263 responses were received. And this poll was to, find sort of a need assessment, like where people are struggling. And as expected, the most of the people were struggling with the conception of idea. We don't know what to do. We all want to do a research, but we don't know where to start, what topic to select, what looks good, what looks publishable. So 31% of the people were struggling with conception of the idea or topic selection, followed by statistics. And that's again not a surprise. Me, myself, I'm not very good at stats. I'll be very honest with you. So 20% of the people were struggling with statistics. And then it was followed by academic writing. 14% were struggling with academic writing, and 11% had problems with synopsis. Journal selection, ethical review is not a big problem, like 6 to 8% people, and literature review is the same. So we'll try to touch base these things. Now, coming to the steps of conducting a research. So if we have to start with topic selection, we have to decide like what do we want to do exactly. Then once we have decided, okay, I want to do something about medical education, I want to do something about significance of feedback in medical education. Then you have to do the next step comes literature review, where you study, read. I'll touch base all of these steps very briefly, and then comes a step of synopsis writing, where you have to draft that what exactly you are going to do. It is advisable to get an ethical review approval, because that makes your research valid and trustable. Then comes a step of data collection and analysis, followed by manuscript writing. I have not included publishing in this in these steps my deliberately, because that's a different complete whole story. I saw. Ask Kumar. Sorry about sorry about that. You might be seeing that. Okay, now comes to topic selection. So, what topic to select? Whatever topic we are selecting, it should be relevant, which means that, for example, if you are in a field of surgery, it should be relevant to your field, because that's going to help you in your future. Uh, so anything related to your specialty, your field, is going to make you stand out in the applications. um, if you are planning to enter into surgery and your research is mostly about endocrine diabetes, that's not, it will be helpful, it will count as a publication, but if you are doing something and if you're already decided your career, your specialty, try to do something relevant to your field. Then comes feasibility. We all think that, oh my God, randomized controlled trials, these are the things I want to do. As a beginner, I will highly say that start with simple things. We all disregard cross sectional surveys. We think that cross sectional surveys are nothing. It's just a simple thing. They will not be countable. But believe me, cross sectional surveys can be very good publications. They can, if you have got good numbers, if you have got good themes in your research, it can be really helpful. Third is, your research should be cost effective. You should not be trying to do something which is requires a lot of financial implications, because that's something not doable for a beginner. Then comes rationale. This makes your research to stand out. This If you have a good rationale doing a study, then you will have a good chance to get that study published. Rationale is like, why do you want to do it? For example, if I talk about something, I'll talk about my study. So I did a study about struggles of motherhood when women are doing postgraduate training in Pakistan. My rationale was because on this subject, if you do a literature review, you will find a lot of studies have been done in West. Unfortunately, there's no literature reported from Pakistan or reported from our countries, because we don't look into these things. So that was my rationale. So if you have a strong rationale, that rationale could be, there's no data from your geographical location. Rationale could be, we need further information on this subject. So if you have a strong rationale to conduct your study, then it is very likely to be published. Then comes ethical consideration. So whatever the topic you are selecting, it should not have ethical problems. For instance, there should not be anything that puts patients at risk. If you Even if you are introducing something new, any new intervention, you have to ensure patient safety. You have to ensure that there are no ethical problems with your research. Otherwise, you are going to face a lot of problems from the beginning. And that's why I say again that cross sectional surveys are the best to start with, because they don't have any ethical problems, and it's very easy. The data collection is very easy, and if you have good numbers, it's publishable. And then applicability and recommendation. This is again linked to the rationale of the study, which means, like, if you have a good rationale, then definitely on the basis of your study, you will be able to suggest some recommendations. And that's where the difference comes. That's where research. So why do we need to do research? Let's talk about this. Why do I need to do a research? I think we all will have this honest answer, that I need it for my portfolio, I need it for my CV. But if you look into it, research is looking into different aspects of things differently again and again, and finding out what's happening and improving our work. So apart from a tick box exercise for your portfolio, it has to add some value to the science, to your subject. So this is all about topic selection. So when you are selecting a topic, take these things into consideration, and select your topic accordingly. This is the most important part. If you have messed up at this stage, then you will suffer throughout your journey. If this is if you have done it well, then you are going to every step will be very smooth. Okay, Ali, would you warn me when, like, 10-15 minutes before, like, I think around 12:30, just give me a heads up, so I'll try to wrap up.
Sure, thank you.
Okay, so now I've got some titles here: medical education challenges and innovations during COVID-19 pandemic. Um, this was this was not a randomized controlled trial. This is sort of a commentary. It's a publication, and it has got 242 citations. Then medical students and COVID-19 challenges and supportive strategies. It's almost a similar sort of study. It has got 224 citations. So if you think about these topics, these are very simple, very easy to doable things. And as a beginner, when we start, somehow I also had this thing in my mind that the research has to be something very fancy. No, it's not. It can be very simple and it can be publishable. And then we read this one: risk factors for surgical complications in ventral hernia repair. This is something we all do very commonly in general surgery, and this thing has got 88 citations. So this is again a reminder that you do not need to do a very fancy study. You do not need to do clinical trials, interventions. You can do simple things, start with simple things, and get them published. Now, how to is my slide visible or okay, that's fine. Just a second, I am having a bit of trouble here. Okay, how to get ideas. Now, we all struggle, like, because even if we are working in a clinical setting, we don't get ideas. We don't, unfortunately. So I will be talking a lot about Pakistan because I've been through this and I know the struggles there. So we all struggle, like, where to get ideas from. I would suggest Twitter. Join Twitter. Follow Twitter. Just search for the terms that, for example, general surgery, medical education, whatever your interest is, colorectal surgery. Search for those and follow up. Follow different. There are different Royal Colleges accounts. There are professors. There are researchers. So there will be a lot of people. You will be there. Okay. We might have a trouble in the meeting. So in case if this session ends, Dr. Ali will be putting another link for the session. So we'll join from that session. How to get ideas. Now, Twitter is the topmost thing. Join Twitter, follow that. I have got a lot of ideas from Twitter. I have managed to achieve collaborative projects via Twitter. Be part of collaborative projects via Twitter. So Twitter is a very good resource. Second is journal clubs. Joining the journal clubs. Uh, if there are no journal clubs in your settings, try to initiate them. Try to start them in your hospitals. Take the initiative. You have to beg your colleagues, let's do this. It's not a big deal. It's like a 30 minutes 1 hour thing every week. Make it regular. Start this practice. Believe me, this is going to change the circumstances of your workplace. People will like that, because whenever there's a journal club, there's an article. Try to pick latest articles in last 5 years. Pick an article, have discussions about it, and uh, you know uh, you can get new ideas when you read an article, and when you discuss with your colleagues. You will generate a lot of ideas, and you will see that this is doable. I can do this. I can do this modification, and we can do this research in our setting. Reading articles, and again, it's the same. So make this habit of reading articles, reading journals, reading abstracts. That this again gives you a lot of ideas for topic selection. Guidance from senior colleagues. If you have good mentors who are interested in research, you can go to them, approach them, tell them that you are interested in, and uh, ask them what to do. Because sometimes you think that this is doable, but your colleagues, senior colleagues, because they are far more experienced, they will tell you the pros and cons. They will tell you the applicability of the research, and that's going to be really helpful. Attending conferences. So attending conferences is also very helpful, and myself, I have witnessed this. So when you go and attend a conference, then you see very simple things getting published, very simple concepts, projects getting presented. You realize, oh my god, this is doable. I can do this. So this is how you generate ideas. Okay. Next, once you have, you have decided that I want to do something about, for instance, significance of feedback in medical education. I've decided that I'm going to work on this topic. The next step is literature review. Now, this is as important as topic selection because you need to go into the depth of your topic. You need to find out what is exactly known about the topic, what is not known, what are the questions, what are the debates. And this literature review is going to help you to frame your research question. You have to frame a research question. Okay, this is what I want to find out from my research. So you should have a very good literature review. Try to read at least 10 full text articles. Make a record of those articles because you will be needing these articles for your introduction, for your synopsis writing, for your manuscript writing. So pick up those articles which are very close to your topic, make a folder, save them, read them, highlight them, the important things that you like, the concepts, clarify your concepts. And then based on this, you are going to frame your research question. There's one more thing. You would need to choose a parent article. So parent article means an article which you think is very close to what you want to do. For example, I've read 15 articles, and there's one article which I think, oh my God, this is exactly what I want to do. You will not duplicate the result, but what you will duplicate the research, what you will do is you will sort of, follow the same pattern. If this is a cross section study, I'm doing a cross sectional study, your sample size will be definitely different from that was done earlier. Your setting is different, so you can if it's a cross sectional survey, you can frame the questions, change them a little bit. But that parent article is going to be really helpful. So choose a parent article for your literature review. Where to do a literature review? You can use PubMed, you can use Google Scholar. Typing the right words for search is an art. You have to decide what you want to find out, and use the correct terms for your literature review. Then you will be able to get good articles. Okay, now comes synopsis writing. Synopsis writing is sort of laying a foundation, laying a base. Three questions you have to answer yourself when you are writing a synopsis. What do I want to do? Why do I want to do this? And how I am going to do this? For instance, I want to find out the significance of feedback in medical education in clinical setting. In postgraduate training, I want to find out what is the importance of giving and receiving feedback. Why do I want to do it? I want to do it because I think it can impact the training. I think it can impact the training. I think it can improve the training. I think we are not doing it very well. So there can be a lot of this. Why is your rationale? Why do you want to do that study? That's your rationale. And then how am I going to do it? So is it going, sorry. So is it going to be a survey? Is it going to be a qualitative study? Is it going to be a quantitative study? So you should have a clear plan. Like it's like a roadmap. If you are planning to drive somewhere, you should have a clear roadmap that this is where I'm going to start, this is where I'm going to take a break, and this is where I'm going to stop. So you should have a clear roadmap as how I am going to reach there, how I am going to collect the data. And that's where, again, for the beginners, parent article is going to be really helpful for you. You can literally copy their methodology, whatever they are doing, because your topic, you want to do the same thing. So you can copy their methodology, like how they are doing it, you can do it the same way. You definitely, your results, your questions will be different, but the way they are doing it, you can do exactly the same way. So that's it, that is going to be really helpful. um we have a bit of limitations because of the Zoom meeting. This meeting is going to end. So Ali, you have shared the next link. You are muted, Ali.
Sorry, I have shared the link on the chat, and I'll share it on the emails right now as well.
Yeah. So
Thank
we'll end this meeting right now, and we'll join with the second meeting. It's just because some time limitations on Zoom. So yeah, see you in the next link. All right.